Hi, everyone. This is Madeline from MHA National. I want to thank you for joining today's webinar. A few housekeeping items first. This webinar is being recorded, and the recording and slides will be posted online. Please send any messages you have in the chat box, and feel free to call out in the chat box where you're from. This is iNAPS, State of the Peer Support Workforce, and our presenters today are Martha Barbone, who is the Interim Director of Operations at the National Association of Peer Support. She received her BS and DMD from Colorado State University. She spent 12 years in the U.S. Air Force before being sidelined by a diagnosis of depression and PTSD. After several years, including multiple hospitalizations, medications, and other treatments, she was introduced to peer support. This led to newfound hope and recovery of inner strength. She has served as the director of the Certified Peer Specialist training for Massachusetts for 4 years. In addition to CPS training, Martha is a certified WRAP facilitator, Alternatives to Suicide facilitator and trainer, Hearing Voices Network facilitator, and SAMHSA Recovery to Practice Next Steps facilitator. She also facilitates Alternatives to Violence workshops in several state prisons. Martha is a member of the advisory board for the VA Healthcare and Implementation Research Program and served as a consultant and editor on a recently published article establishing a research agenda for understanding the role and impact of mental health peer specialists. Martha was the first and only peer specialist on the inpatient unit at Brigham Women's Faulkner Hospital. She currently works in an urgent care setting. Her passion today is sharing this hope with others and working to reduce the trauma associated with inpatient psychiatric treatment. Dana Fogelsong has been a systems change leader since 2010. She currently works as the Director of Recovery and Resiliency Services for Magellan Complete Care, a specialty health plan for individuals living with mental illness. Prior to joining Magellan, Dana worked for the Florida Department of Children and Families in the Office of Substance Abuse and Mental Health, contracted with Disability Rights Florida to provide outreach to individuals with mental health conditions, and founded the statewide peer network, the Peer Support Coalition of Florida. In these roles, she has leveraged opportunities for current and past recipients of services and their families to have their voices included in the creation, implementation, and review of practices. Dana is a subject matter expert on recovery-oriented systems of care, supervision of peer support workers, and peer-delivered and whole health approaches in integrated health settings. She frequently speaks, trains, and consults on these topics. Dana is a former member of the National Alliance on Mental Illness National Board of Directors and the National Association of Consumer Survivor Mental Health Administrators. Along with her board services to iNAPS, she currently serves as the Vice Chair of Florida's Substance Abuse and Mental Health Block Grant Planning and Advisory Council. She is a nationally certified peer specialist, an advocate-level RAP facilitator, and holds a Master's of Social Work from the University of Central Florida. I'm going to hand it over to Martha and Dana now. Thank you.
Thank you, Madeline, and thank you, MHA, for having us on today to talk about this very important topic. So I'm going to try to figure out how to go through here. Hey, Madeline, I'm having an issue. Oh, okay. I think I have a keyboard that is sticking. My apologies. I'm trying to get us back on track. Okay, I'm going to get going. I'm not sure what's going on, and actually, Madeline, if you could perhaps just take back control. It's the slides aren't working for me. So we are the National Association of Peer Supporters. You may know us as the International Association of Peer Supporters. In January of this year, we changed our name and our focus from an organization that was looking at general peer support initiatives across the world to a trade association for the peer support profession in the United States. We are a membership organization, and our members primarily include peer support specialists, but also include individuals that work along peer support specialists like supervisors, coworkers, allies, and really anyone who believes in our mission is welcome to become a member. Our mission is to grow the peer support profession by promoting the inclusion of peer support specialists throughout healthcare and community systems in the United States. And to give you a sense of the current projects we are working on, we just actually finished a national study with Boston University that closed yesterday on the impact of the coronavirus on peer specialists. So we're looking forward to that getting published. We work closely with the Patient Center Outcomes Research Institute. We're going to be launching a supervision learning community very soon, and also some of the activities that we're going to be sharing today in this presentation, and one of those being redoing the compensation and satisfaction survey. Next slide. So today we're going to be going over specifically the data that we have on education, compensation, and satisfaction. We're going to talk about the national practice guidelines for peer specialists and supervisors and describe how and why we developed a standard occupational classification. Next slide. So typically you see references at the end, but we wanted to put them up at the beginning just to show you that everything that we're talking about today is published or is part of an existing report. So some of these date back to 2016, but in general, this information is from the last couple of years. And we'll kind of reference you back to these as we talk about the information. Next slide. And Martha's actually going to take us into some of the data that we have on certification and compensation and satisfaction.
All right. Hello, everybody. I'm so glad to be here. One thing you'll see as we talk about certification, compensation, is this isn't brand new data. And it's been very difficult to collect data about our profession, and we will sort of explain that as we go. But what this graph shows here, this was a study that Jessica Wolf did that was published in 2018. She surveyed certified peer specialist certifying agencies in all 50 states in the VA, specifically asking for when they started a certification process and how many people had been certified since they began. And this was geared at mental health certified peer specialists. And so from that data, they received data that there was 25,317 mental health certified peer specialists in 2016. At that time, I believe 39 states had certification going, and 7 more were in the process of starting certification. Today, many of those do have certification, but like one that's very obvious that doesn't, that's very big, is California. And we also know that there's a lot of people doing peer support that may not be certified or don't work in a position that requires certification. And looking at just mental health peer specialists doesn't get the whole picture of peer support, because in some states, like I'm from Massachusetts, we have certified peer specialists and we have recovery coaches, and our jobs definitely overlap. We just kind of come at it more from have been in the mental health system or have had substance use issues. So it's very difficult to get numbers on the total number of people doing peer support work. Next slide. So in 2007 and again in 2014, iNAPS did a survey of peer specialists about education, compensation, and satisfaction. And this was published in 2016, but the data really is from 2014. And we are right now in the process of updating that survey, and we will put it out very soon and try to collect more current information. But this does tell us a lot. So back in 2014, one of the first things we did is survey job titles. So I know myself, I'm a certified peer specialist. Like I said, here in Massachusetts, we also have recovery coaches. But what this slide shows is 36% of people identified their job title as peer specialist. Peer advocate was second, and then recovery support specialist. But some of the others were recovery coach, recovery educator, recovery trainer, peer coach, peer bridger. And there were 165 other responses, and those were all other unique job titles. So you can see we're trying to count the number of certified peer specialists, and it's like, does that really get everyone doing peer support work, because that isn't their job title. And this was also reflected when we developed the National Practice Guidelines. In those surveys, there was 219 unique job titles. Next slide. So the next interesting thing in 2014 is the largest age group of people doing peer support was 45 to 54 and 55 to 64, a close second. So that's my age group. I think if we do this survey again, we're going to see a shift. And I think that's a great thing. To me, I relate to having been in the system for 20 years and not working. So I didn't come into peer support until I was in my 50s. And I'm so excited to see that people are getting involved in peer support at a much younger age now. Next slide. We also looked at race and ethnicity, and this wasn't surprising that 70% of our respondents were white. We used the classic definitions of race and ethnicity that you'll see like on the census in most forms of white, Black, Hispanic, Asian, Native American, and other. I hope this has changed some. My own experience is it's still a very white-dominated field, and this is one of our issues that we're looking in. How can we be more inclusive, and is peer support going on that we don't know about and we're just not including people? Next slide. I also think it's very interesting when we look at education. So on the left side, it goes from some high school to a high school or GED, on to trade tech school, some college, and then associates, bachelor's, master's, postgraduate degrees. So you can see in 2014, 85% of the people had at least some college, and over 50% had a degree. I always like to say that, my education isn't what makes me good at peer support, and I don't like it when advancement in the field is tied to education. But what it does show is how much more we bring to this field than just a certificate. Many people look at us as, oh, well, you have a certificate, you went to training for a week or two. But along with our lived experience is our life experience. We're bringing so much more into this. People have been business owners, people have been in the military, people have been supervisors. People have done all kinds of things before they came to peer support. And that's all part of what we bring to this role. In addition, over 50% people said they held another certification, license, or credential. So again, that's more that we bring to this role. Next slide. We also looked at where people provide support, and over half was either in urban or large urban areas, and then with suburban and rural coming in behind that. Definitely a real need for peer support in rural communities where there's limited access to everything, and peer support can be something that is available everywhere. Next slide. So now I'm going to go into the compensation and satisfaction, and these slides will show a comparison between 2007, when we first did the survey, and 2014. And this is overall compensation, looking, this isn't separated by region or state, and it's also adjusted, like some people are paid salary, so there was a calculation for what that means hourly. The interesting thing I find here, in 2007, the federal minimum wage was $5.85. And in 2009, it went up to $7.25. And the federal minimum wage still is $7.25. But most states, many states, over 30 states, have a minimum wage above the federal minimum wage. But still, when you look at this, for what we bring to this field, we all realize that our pay is relatively low. We see here that 93% in 2014 had received job training. I would hope all of us doing this work have some kind of training and support to do the work we're doing. So it'll be interesting to see how this changes. There is a study that was done in 2018 that took this data and actually divided it out by region and by state, so you could see how hourly pay was in your state versus other parts of the country. Next slide. Next slide. Oh, sorry. Didn't see it move. So the next thing we looked at was, how do peer specialists rate their overall job satisfaction? And, over 88% as mostly satisfied or always satisfied. I think most of us do this work because we're passionate about it, and the work itself is satisfying, and that's good to see. It would be hard to stay in this job if you didn't have any satisfaction that what you were doing gave purpose and meaning. Next slide. So then we asked, what was the greatest reward for working as a peer support provider? And you see that we're not in this for the money. 2.1% in 2014 saw being paid as their greatest reward, whereas 86% said helping others was the greatest reward. And again, that gets back to, we're doing this work because we're passionate about it. Yes, for many of us, I came off of being on disability 20 years and went back to work. So yes, it was nice to be off disability and get a check, but I'm doing this because I'm passionate about it. And there's still 10% that it helps with our own recovery. We know that to help others can be one of the greatest things that we can derive happiness from. Next slide. Is this the next slide? Did I miss one? Oh, there we go. So the next question was, how did peer support report feeling respected by their supervisor and colleagues at work? And I think it's very interesting here that in 2007, those that strongly agreed, it was 65%, and in 2014, that had dropped to 44%. It's still, here almost 80% that sometimes or frequently agree, which is good, but this is something that we know people struggle with in the workforce, is feeling respected when they're on a multidisciplinary team, feeling that their voice is respected, and feeling that the work they do is respected. Next slide. Dana, are you going to take this one?
I can. So this is a very recent study that came out this year. Primary researcher on this was Nev Jones, who from the University of South Florida, and it was looking at the impact of organizational climate on basically peer support and peer support career ladders, and basically found that the higher level of perceived organizational support, the more that you're going to see career development and perceived service quality. There's a greater depth of participation in roles and responsibilities in leadership positions and representation when those environments are supportive, especially in cases where sometimes you'll have case management responsibilities that are given to peer support specialists, and organizations where that is not happening, or that's not happening a lot. That is a major indicator of a supportive environment and a positive climate to work in. Next slide. So now I'm going to be talking about the National Practice Guidelines for Peer Supporters. This is an iNAPS document, and it started way back in 2007 when member surveys were sent out to try to get a sense of what the core values and practices of peer support look like. And then in 2010, research happened to look deeper into this beyond membership. And in 2012, with the support of SAMHSA, a task force was developed, and those task force made recommendations. We made sure to get buy-in from the substance use recovery community, and then we sent this the draft out to over 1,000 people who responded and got 98% agreement on the core values. These were published in 2013, and most recently in 2019, the World Health Organization published the National Practice Guidelines in one of their guidance modules on one-to-one peer support by and for people with lived experience. Next slide. So these are the core values from the National Practice Guidelines. I will point out that number one, peer support is voluntary. Sometimes gets confused. That does not mean that peer support services should be free all the time. Sometimes there is, of course, volunteer peer support. There's obviously still great mutual support groups that happen in our community, but this is really talking about in a peer support service or relationship that it should not be required. So the person receiving the service should be willing and wanting to get peer support. So these are the 12 values, and a lot of times I'll get asked my sort of opinions on peer support program, and I think that these values are, to me, the real guide to use to really sort of evaluate whether peer support is being done in the way that we know makes the most impact in people's lives, and the way that research tells us, and anecdotally, and what we know to be peer support. So besides peer support is voluntary, peer supporters are hopeful, they're open-minded, empathetic, respectful. A big part of peer support is facilitating change. So many of us in our organizations are also a part of bringing the bigger recovery message and really being a part of changing that organizational climate that we just talked about. Peer supporters are honest and direct. Peer support is mutual and reciprocal. Peer support is equally shared power, which is really a hard one to do, especially when just the idea of a peer supporter getting paid creates that hierarchy. So this is a really tricky one to try to pull off, but really important to and foundational to peer support. Peer support is strengths-focused. Peer support is transparent and person-driven. So these national practice guidelines are on our website and, again, can be found in the World Health Organization document. Next slide. So over the last, I'd say 7 or so years, there's been a lot more focus on providing support for supervisors. So one thing that we know is that the Medicaid guidance, when that came out from CMS, it talks about the need for supervisors to be licensed or basically qualified mental health professionals in their state, which typically translates to professional. And what's happened is that many organizations who are not Medicaid available have really adopted this practice of using a licensed clinical supervisor to supervise peer specialists. So a couple years ago, we convened a small work group to start looking at the needs and the resources around supervision and peer support staff. And in looking at what was available, we realized that iNAPS really needed to provide some leadership on this effort. So we expanded the work group to formally collaborate with iNAPS and develop a peer support workforce committee to really develop out some of these things that we knew needed to be done to support supervisors. So we identified and reviewed and indexed supervision resources, which are available on the iNAPS website. So there is a tab for supervision, and you can find not only research studies that have been done on this on the topic of supervision, but there are also a whole lot of resources that we collected and mined and vetted that can kind of give you some sense of the different trainings out there or guidance that originally has existed. So then we started to research the Department of Labor process for establishing a Standard Occupational Classification for the peer support title, which I'll talk about in a minute. And then we went back and looked at the original 2013 National Practice Guidelines for peer supporters and started to develop and create a framework for developing guidelines for supervisors. So in that process, we did a needs analysis. We started to draft guidelines. We held focus groups that were advertised along our membership group and our listserv. And those focus groups had supervisors, they had peer specialists on them, and from that we were able to refine the guidelines and then eventually send out a consensus survey to supervisors and peer specialists to make sure that they really aligned with what was happening and where we needed to go. And then in the fall of last year, we started to present the guidelines in a couple different arenas throughout the country to get feedback. And then finally in October, on our 13th annual conference, we unveiled the National Practice Guidelines for Supervisor. So it's been quite a process. Next slide. So the image that you see is what the guidelines look like. If you go and pull up the guidelines, you'll see that on the left column there is the core value. So in this example, peer supporters are open-minded. And then we pair that with the original 2013 guidance, which is the practice of what the peer supporter will do. So peer supporters are open-minded. The practice is withholding judgment about others. And then on the far right is the supervisor's guidelines. So this is really how the supervisor can promote the practice of peer supporters being open-minded. And I will say that some of the critiques that we have gotten on the guidelines is they don't go into some sort of a lot of the technicalities of supervision, and we know that 100%. So these guidelines are really about helping the peer supporter to stay within the values of peer support and really starting to educate the supervisor on how they can role model that, support the peer supporter in that. Obviously, there's a lot of challenging situations that come when providing peer support. So this is really supposed to help give that guidance to uphold those values that we have in the peer support profession. So we have some suggestions on how to use those. First of all, go to our website, look at them, print them out, get to know them. We encourage you to share these guidelines with your employer. If you're a peer specialist, with your supervisor. If you're a supervisor, with your peer specialist on staff. We know that while this has been around for 7 years and it's been published in different forums, that this is still not common knowledge. So we definitely want to stay true to our values. So this is something that is important to share and to really put into practice. And we do suggest that. Focus on putting one of these values a week into practice and seeing how that goes and using these guidelines to really promote and expand that. We also really highlight using them in supervision sessions, sharing examples with your fellow peer support specialists, and using these challenges that you experience and how you work with them using the core values as a good learning opportunity. Next slide. Okay, so now we're going to get into something a little bit more tricky, which is the development of the Standard Occupational Classification for Peer Support Specialists. So frankly, we kind of stumbled on this issue in the process of working on updating the National Practice Guidelines. So a Standard Occupational Classification is used by federal agencies to classify workers into occupational categories. And this is for the purpose of collecting, calculating, or disseminating data. So currently, a U.S. Department of Labor, which is who does the SOC, the Department of Labor does not have a Standard Occupational Classification for peer support specialists. And because there is not this classification, there is not national information about peer support workers. So we know that peer support specialist data is likely being classified right now as community health workers who go by various titles. We also believe that some of this data is being rolled into social worker, the social work definition. And so this is obviously problematic for the peer support profession, but it's also problematic for community health workers and social workers. And Madeline, just so you know, the image of the slide went away, but I'll keep moving through this. So the process to add a Standard Occupational Classification takes many years. So we started actually a couple of years ago working on this. And the reason it's really important, you know, Martha talked about the fact that we don't have a lot of data. I mean, ideally we could have come to you today with data, you know, within the last 1 or 2 years. And that wasn't just through a formal survey by iNAPS, so it was on a larger scale. But because there is no definition, it makes it really complicated. So we believe that once we're able to get this Department of Labor title classification for peer support workers, that this will help promote national data on the number of employee peer support workers and their compensation. We'll have a better sense of being able to differentiate between the scope of work performed by peer support workers from other human services roles like the community health workers, like counselors, social workers. We expect that this will really increase our professional identity and respect, which is, I think, definitely grown as times go on, but there are still definitely some challenges in the workforce around this new profession. So what we did is we, as part of the work group, worked to define and make a definition. So Madeline, if you can go to the next slide. So I want to be very clear here that if you're looking at this definition, you're going to say, okay, there's a couple things missing. So, and the reason is because the definition is primarily a title classification. So it's focused solely on the unique work tasks performed in order to conform to the required format prescribed by the Department of Labor. So if you look at the other definitions for other professions, you'll see this very similar, almost like template of what a definition looks like. So, and in terms of the title, we went with peer support specialists Actually, we've done several surveys and found that this is the title most commonly used. And so we recognize that there's a lot more titles used by peer support workers, but this proposed title does not prevent the use of other job titles, such as a recovery coach, a peer navigator, peer bridger. This is just the title definition for this effort around getting this definition through the Department of Labor. So I am going to read this to you. So number one, peer support specialists provide non-clinical support services. So this is very important. It is non-clinical. Obviously, we're not trained or licensed to provide clinical services, and that would be outside of the scope. And that is both for individuals and groups. And this aligns with established guiding principles and core competencies. So beyond the national practice guidelines that iNAPS has, SAMHSA also has core competencies and the guiding principles for recovery. So peer support services should align with all of those established guiding principles. A big part of peer support is disclosing personal experiences of overcoming challenges in ways that inspire hope, empowerment, and positive action. So I would say in the far past, peer support was primarily seen as something for mental health and substance use services, but we are now seeing and have seen peer support grow into other areas, probably more focused on trauma than saying it has to be a distinct sort of diagnosable challenge. So that's why we went with overcoming challenges. And we did hear that that was especially important to our young adult and youth peer specialists and family peer specialists, and also forensic peer specialists. The third thing is that peer support specialists engage individuals in personalized peer-to-peer relationships that support development and use of skills to manage crisis and achieve recovery, wellness, and life goals. So, this is where it's very important that we point out that these are peer-to-peer relationships, kind of going back to those national practice guidelines, that mutually shared power is important. And really, peer support speaks to this idea that it's not just beneficial to the person receiving services, it's beneficial to the person supporting that peer that's getting the peer support. So it is it's a mutual relationship, and I think that relationship word is really important here. The fourth is using personal knowledge to navigate systems and link individuals to resources and services, including education, employment, and social activities that can help them to achieve their goals. So the personal knowledge to navigate systems, for me, my experience of overcoming some pretty significant mental health challenges, I learned a lot about what was available in the community and specific resources that I needed to use to get, for example, myself off of Social Security disability. And so that's what we're kind of talking about in the using personal knowledge to navigate those systems. And then we go into some Mays. So, and this doesn't mean that these are not really important to peer support. This just means that this, in the particular profession and the arena that the peer support is being offered, that this may or may not happen. So one of the Mays is to educate individuals or groups as well as their family members about health, wellness, and recovery. So there are definitely some jobs that would not have this to be a part of it. Another May is to use lived experience to educate colleagues on using person-centered, recovery-oriented practices when interacting with individuals in or groups to enhance the provision of services and support. So this is going back to the core value of that peer supporters facilitate change. And then the last is that may engage in facilitating individual rights and systems advocacy. And I will say that the number 7, the individual rights and systems advocacy, was where we had the most conversation and the most feedback on. Actually, at our annual conference, we had a caucus to talk about this very issue. And so, again, we're saying this, depending on where your job is, this may or may not be a part of it, but it is definitely a part of peer support. And this last one is just kind of how the template for these classifications go. So this would exclude data related to community health workers. So that is our proposed definition, and that's what we're continuing to work on and advocate for. Next slide. So one of the ways that you can help, every year an American Community Survey goes out. So every 10 years we have the census, but we also have this other survey that goes out, and it collects information on occupation. So one of the feedback that we got from the Department of Labor is that in order to get sort of the base for the definition to really be looked at, it would be very helpful if we had data coming in from this American Community Survey. So we're asking that if you do get that, to write in peer support specialists for the occupation. So it's perfectly normal to write in the occupation. That's how you do it. So if you do get this and you are a peer support specialist, please write that in using that language. Use peer support specialist because that is the title that we are using in the definition. And Martha actually got this survey this year. So she was able to write peer support specialist, and I feel like she got the golden ticket from like Charlie and the Chocolate Factory. Pretty lucky there. So it does happen.
I was going to say, this survey, it's randomly sent out, and it's by address. It's just they randomly select addresses, and they send some out every month throughout the year. So even if you haven't seen that this year, you might still get it. It goes to about 3.5 million people in the U.S. So, just be on the lookout for it.
Thank you. Next slide. So we are asking you to join us for our 14th annual conference. We had planned on having it in Baton Rouge, Louisiana. So if you're familiar with Baton Rouge, that's Baton Rouge. But of course, with everything going on in the world, we have shifted to a virtual conference. So it's going to be October 13th to the 17th. Technically, we're doing 2 full conference days, one on the 13th and one on the 17th. So hoping to see that if you're, one day is on a weekday and one is on a weekend. So we're trying to be available for people to join us live because this will be a live virtual conference. It's not going to be pre-recorded. And then we will have a global peer support celebration day in the middle of that on October 15th, which we'll be sending out more information both about the conference and the Global Peer Support Celebration Day. Registration is going to be coming out pretty soon. It's not available right now. Martha's working on getting the agenda finalized with a lot of awesome presenters and topics. But we encourage you to check out our website, www.peersupportworks.org. And if you're not a member, consider joining us or at least sign on to our listserv so that you can get the information about the conference as it comes available, as well as all the cool things that are coming up soon, like the supervision learning community and the results from the Boston University study. And we will definitely want peer support specialists participating in the upcoming redo of the compensation satisfaction survey, an education survey. So next slide. So we just wanted to have some time at the end for you all to ask questions. So I believe we've got 15 minutes for that. So we're right on time. So Madeline, I'll let you facilitate that.
Yeah, so one of the first questions that we got was what the denominator was for the slide about where peer support specialists were located.
So I don't want to go back to the slide, but so the N for that, the denominator was 574, and I think in the slide it shows how many in each, in each category. So the percentages on these slides are actually from the raw data from the survey. That data was refined, so you will see it in a published version that the percentages are a little different, but the distribution is still very close.
Another question that we got was about what role peer support specialists should be playing in case management.
Answer that. So I was the one that referenced case management when we were talking about the study for organizational climate and support. And what that study was talking about was when there was higher rates of case management responsibilities given to peer support specialists, there were lower findings of a positive organizational environment. And so what we see a lot happen and throughout really the country is that there has been quite a buzz around peer support, which is great. But sometimes what has happened is that there hasn't either been additional funding or support for actually employing a peer specialist. So what can happen is that a traditional sort of case management job gets the title of a peer specialist, but the peer specialist comes in and is doing primarily or all 100% case management duties. And really peer support, that's not what the job is. So the definition that we went over, and Madeline, feel free to kind of go back to that because that's probably one of the most important things. It's like 3 slides back. Peer support really does look different than case management. It really is grounded in those values of the national practice guidelines and developing that peer-to-peer relationship. It is not primarily a case management. In fact, often there's very little case management functions in there. Of course, there's got to be documentation. If it's providing a service that's being reimbursed, and there's other paperwork and things that have to go along with that. But in general, it is not case management. You can definitely have a person with lived experience in a case management role, but it really does muddy the water if a peer specialist title is used for a job that is not peer support.
Great, thank you. We also got a question about what role peers should have in management positions and how they should handle difficult situations, such as when a suicidal intent is discussed with them.
Okay.
Could you repeat that? Oh, sorry. Go ahead.
Yeah. Let's break that up because those are kind of 2 different topics. So, Malik, can you say the first part again about peers and management?
Yeah, what role peers should be playing in crisis management situations?
Okay, sorry. I thought what peers should be playing in management positions.
Oh, no, crisis management.
Oh, okay. All right, I'll let you take that, Martha.
So peer support's, for me, definitely involved. I facilitate every week an Alternatives to Suicide group where it's safe for someone to come there and say they have thoughts of self-harm or suicide, and I don't call the police. I don't take them to the hospital. There's a lot of confusion over mandated reporter law in most states. If you actually look at mandated reporter law, it doesn't cover self-harm or suicidal ideation. It's about abuse or suspected abuse by a caregiver of someone under the age of 18, an older adult, or someone with a disability. That doesn't mean that you don't have organizational policy that requires you to report. And I think the important thing for peer specialists is to be transparent. Don't tell someone you can keep everything confidential when in fact you cannot. Your organization requires you to report. But the other thing we can do is to help people get connected to a resource, like Alternatives to Suicide groups are not connected to a clinical organization. So if someone struggles with that, you might be able to connect them to an outside group. Or sometimes you can work with people about how they say things. We find that a lot of people say, I'm suicidal, because that gets everyone's attention. If I say I'm having a tough day, I'm really struggling, okay, it'll get better, and then you just get pushed off down the system. If you say I feel suicidal, all of a sudden people are paying attention, and it might not be the attention that you want or that is helpful, but it's attention. And usually when we're doing something for attention, it's because we have a need that's not being met. So one thing peer support can do is help people find the language to ask for what they need, and to make, be able to talk about what's going on for them without maybe saying the word that's going to trigger an automatic action, and they're going to find themselves in a restricted environment that they don't find helpful. This really varies state to state. It varies within organizations in states, and I've even seen it vary on different teams within the same organization. And, for me, I'm a person that has had suicidal thoughts for many years, and I learned not to ever talk about them because it wasn't okay to talk about. Now, that didn't do very much to make them go away. And I think in our role as peer support, we help people to be able to give voice to that and get support that they find helpful.
Great. And then there's been a lot of chat about how forensic peer support specialists fit into the larger peer support landscape. And I wasn't sure if either of you had any comments you'd like to make on forensic peer support specialists.
Well, one thing I just say, the environment, the setting that you do peer support in definitely differs. If you're in a peer-run organization, you have, in a way, more freedom than if you're in a forensic environment. One of our values is to respect self-determination. Now, if someone's in a forensic environment and they say, I want to leave, as peer specialists, we don't have the power to respect self-determination. So it's about what can you do? How do you develop that relationship and be transparent about what your limitations are? People can still benefit a lot from peer support. The program I do in the Prison Alternatives to Violence program is really about trauma, and it's amazing the men I work with who have discovered peer support on their own to help each other through what is a horrific situation. So, there definitely are restrictions based on the environment you're in. And sometimes you have to say, I call it like, what's my line in the sand? What am I willing to do that really kind of pushes my values, but I'm willing to do it while I'm trying to make change? And what am I not willing to compromise on? And sometimes that means, I can't work in that environment because I can't compromise my values to not respect self-determination. And I think that's individual for each person. And when you're looking for a job in peer support, you need to really examine for yourself, how will this environment affect me in my ability to stick to my values?
I would add that as a workforce issue, there are definitely discriminatory practices and laws related to individuals using their lived experience and coming back and working in the system. So, for example, some states have background screening laws that are pretty much designed to prohibit anybody with a criminal past, and even things like, small misdemeanors into working within agencies. So we really have a lot of work to do to try and get the field more equitable in terms of some of the practices related to employment or some of the laws in the state that are really hurting some of the best people who, can really relate to individuals in that situation to provide that support.
Okay, well, that covers all of the questions we've got. So thank you very much. We will be sending out the slides and the recording of today's webinar within 4 business days. If you need a certificate of attendance, please send an email to mhalpern@mhanational.org. Thank you, everyone, for attending, and have a great day.